Psychology in Seattle.
Hey, deserving listeners. Today's episode is about trauma and trauma treatment, specifically cognitive processing therapy. People have been asking me to talk about cognitive processing therapy because it was recently featured in a This American Life episode. Patron Jenna wrote to me saying that she heard the episode and she's like, you know what? Cognitive processing therapy kind of reminds me of DBT. And it also reminded me of the fact that you often will talk about on the podcast about how a lot of different therapies overlap. Is that what's happening here? Is cognitive processing therapy overlapping with DBT and a lot of other therapies? And she says, as a clinician, I might not be using cognitive processing therapy or DBT or any other particular modality, but it's not to say that during therapy, I don't do good work with my clients. And so I want to go into that today. But first, let's just talk about trauma in general. Trauma is a big problem around the globe. I don't think any of you listeners out there would be surprised by that. About 10% of people around the globe will suffer from PTSD at some point in their life. And PTSD is a pretty rough condition. It's not like, oh, I've been sort of traumatized. PTSD is debilitating. It's awful. And for 1 in 10 people around the globe to suffer from PTSD, not only are we looking at a situation where a lot of people are being traumatized, which is unfortunate, but also we're looking at a public health crisis where are there enough clinicians out there who know what they're doing who can actually help people with this? And the answer is no, absolutely not. The vast majority of people with PTSD never get treatment, either because there isn't a clinician in their area or stigma, or the clinician they are sent to doesn't know how to treat PTSD or doesn't do it well. But that's just PTSD. 1 in 10 people around the globe will suffer from PTSD at some point in their life, but that's just PTSD. There's a much higher percentage of people who will experience difficult events, trauma, and other kinds of situations that will lead to trauma reactions that are things like PTSD or other things that aren't necessarily in the DSM. If we're just going to stick to the DSM or somewhat adjacent to it, with trauma, you can suffer, obviously, from PTSD, complex PTSD. It can be a major factor in addiction. It can be a major factor in emotional difficulties, relationship difficulties, personality disorders like borderline or narcissistic, dissociation, obviously, anxiety, panic, depression, low self-esteem. So when you add up all the different effects of trauma, it's a huge issue. I'm just going to say, I don't know a single person who hasn't been traumatized, at least somewhat. I mean, I suffered from PTSD, and like I said, all of us have been through some version of trauma, but I had a medical procedure that was very traumatic for my psyche. My prefrontal cortex was fine with the procedure, but there was something about it that triggered in me some sort of deep reaction, and I, for years, had PTSD after that. And because I learned how to treat trauma over the years, I actually treated myself and cured myself of my own PTSD. So anyway, many people are walking around with conditions related to trauma that therapy could help with. And trauma conditions, particularly PTSD, are pretty easy to cure, pretty easy to help with proper treatment. There's a lot of things that people come to therapy for that are really hard to treat, like personality disorders can take a long time. Finding the meaning of your life can maybe never actually, therapy might not ever help with that. Ongoing grief, sometimes therapy can have trouble with. But when it comes to PTSD, we have ways of actually curing that condition. And when you know how to do it, it's pretty easy, actually. It might take some time, but as long as you know what you're doing as a clinician, you can actually really help people. So the problem is, though, in my field, and I've talked about this before, is that most clinicians are not trained well about trauma. And they're also not trained well enough to know that they're not trained well enough. So you have a lot of therapists walking around thinking that they can treat trauma when they actually can't. And that's a problem, right? It's one thing to walk around with a bunch of clinicians who don't know, say, how to treat anorexia, for example. In my circle, if someone had an eating disorder, most therapists would understand that unless they really understand what they're doing, they probably should refer to a specialist in eating disorders. But when it comes to trauma, for whatever reason, and it's becoming less so as time goes on, thank God, but it's not it's taking too long, in my opinion. But people are starting to realize, but not enough people are realizing that trauma is such a complicated issue, and PTSD is such a complicated treatment style, that you have to really know what you're doing, meaning you have to have taken courses, and you have to have a lot of experience, and you have to have supervision from from experts who know what they're doing. And so for the first 10 years of my practice as a therapist, I didn't really know how to treat trauma, and I didn't know because I was never really taught. Graduate school is, if as a program, I used to be a program director of a graduate program, and of the program I teach in. And one of the questions that I would sometimes get was, how come there isn't, how come you're not training your people how to treat trauma? How come you're not training your people how to treat grief? How come you're not training people on dissociation better? How come you're not training people on humanistic therapy better? There's various different questions that I would get. And my standard answer to them all was, what I would say is, believe me, if I had it my way, I would take my time and train all of these graduate students to be good at 65% of what they need to know in order to be a good therapist. But guess how long that would take for them to get through school? It would take them like 10 years. And that one, that's too long. Two, it would be really expensive. It would be on the order of like $500,000 to pay for that from a student. So after you graduate, you'd have this loan of $500,000. So I would say that, and I'd be like, and plus no one would want to come to our school because, you have other programs out there that are advertising 2 years. It's like, well, I can practice in 2 years, or I can practice in 10 years. So that was my answer, and it's always a game of trying to figure out, like, well, what do we prioritize? And although 3 years of education sounds like a long time, it's not. And there's fundamental things, ethical codes and legal issues, and just general theory knowledge, and the ability to conceptualize, the ability to talk to people. These are fundamental things that we have to teach people in graduate school. And so now, I think trauma therapy should be included more often than it's not. And in some programs it is. But even if you're just taking one class on trauma therapy, that is not enough education, I'm here to tell you. At this point, in a lot of graduate programs, including the one I'm teaching in, you can graduate with a master's in marriage and family therapy or counseling and start practicing, having only been exposed to 1 week of trauma education, meaning that in the psychopathology class, you studied trauma-related disorders for 1 week, and you maybe talked about treatment for 15 minutes. So that might shock you, but again, if I showed you everything else that we have to cover, you might understand. So because I'm a product of that system, I really didn't know what I was doing with trauma in the first 10 years of my practice. I didn't know what I didn't know. And I actually started treating people with trauma, and I made some mistakes. When I look back at some of the clients that I treated who had PTSD, I failed them. I either went too fast because I didn't know any better, or I didn't go fast enough. Or I didn't know even really what PTSD was. I mean, I knew the symptoms, obviously, and, I'd heard it explained, but PTSD, dissociation, complex PTSD, personality disorders, these are extremely complicated things. They're not intuitive, is the thing. Depression and anxiety tend to be intuitive. Depression and anxiety, for the average person, it doesn't take them long to understand it. PTSD, not as intuitive. And there's a lot of misinformation out there. Because PTSD has a lot of different presentations. PTSD is very complex. For some people, it is quite simple, and I've cured people's PTSDs in PTSD conditions in 5 sessions, 5 to 10 sessions, and other people, 5 to 10 sessions. That's a joke. Like for me to treat their PTSD, it took me like 5 years. And, how do you know the difference as a therapist between those two people? Because if you treat everyone like they're 5 sessions, you'll go way too fast and the client will drop out or be re-traumatized by your treatment model. So PTSD is very, very complicated. And, So there's a lot of misinformation out there as well. One of the things that I talk with supervisees and novice therapists about, when I talk about trauma or when the topic comes up, sometimes I'll hear this comment like, oh, it's okay, so the person has PTSD. Well, aren't we supposed to use EMDR? EMDR is one of the treatment modalities for trauma. And this drives me crazy because EMDR, yes, is evidence-based and it works for sure. But it'd be like if you said, oh, I'm hungry. The only thing I can do to cure the hunger is to eat kimchi soup. Well, yeah, kimchi soup will help you with your hunger, but there's billions of other things you can do to cure your hunger. If you want kimchi soup, go for it. But, what if you have to drive to another state to get kimchi soup? What if you just have to drive down to the corner store and buy yourself a hoagie, and that will solve your hunger? So that's what it's like for some people in my industry when they start talking about EMDR. It's like they think of it as the only way to treat trauma, or they think that cognitive processing therapy is the only way to treat trauma, or they think that DBT is the only way to treat borderline personality disorder. And yeah, these are ways, but they're not the only way. And certainly EMDR, we don't need to rely on that. I've never been attracted to EMDR because there are other easier ways to actually treat trauma, in my opinion. EMDR involves eye movement desensitization or, bilateral stimulation, which I find to be completely unnecessary, not only in terms of just the modality, but also like I'd have to take extra training. I would have to get equipment in my office and whatnot. And it's like, why would I add that on when I know how to cure PTSD in other ways? And so I'm not dogging on EMDR. I'm just dogging on the idea that EMDR is the only way. So anyway, that's my little thing about trauma. In this episode, I'm going to talk about trauma. I'm going to talk about PTSD. I'm going to talk about cognitive processing therapy. I'm going to talk about the This American Life episode that goes into cognitive processing therapy. I'm going to talk about other trauma therapies, EMDR included, trauma-focused CBT, exposure therapy, others. And I'm also going to provide my model of treating trauma. I've talked about this before, but I've actually changed it. I'm always sort of changing it the way that I like to explain it to emphasize other aspects of it. And so I've actually added a step. I actually did it recently. I was lecturing in class to some students, and suddenly it occurred to me, you know what? I think I should change step 5 from this to this. So I'll be talking about that. This is the Psychology in Seattle podcast. I'm your host, Dr. Kirk Honda. I'm a therapist, and I'm also a professor at Antioch University in Seattle. And this episode is just for patrons of the podcast. So if you're not a patron on Patreon, then this episode will end before the content begins. If you want to hear the full episode, you have to become a patron at patreon.com. When you become a patron, you'll get instructions on how to access this episode, in addition to hundreds of other premium patron-exclusive episodes, arguably our best episodes. I've done deep dives on attachment theory, deep dives on schema therapy most recently. So become a patron and you will get access to all those episodes. And it's also a great way that I just know you like this podcast because I'm always trying to find out if anyone likes what I'm doing.